this year we presented our data from the GAIN randomized control trial. So this was a randomized control trial taking older adults who were 65 years and older, starting a new chemotherapy regimen. And they were randomized to receive what's known as geriatric assessment-based interventions versus standard of care or usual care, where they just complete a baseline geriatric assessment. And what we've really found in our study was that when we do the geriatric assessment-based driven interventions, essentially intervening on vulnerabilities that are detected on the geriatric assessment for our older adults with cancer, that we were able to significantly reduce toxicity that these older adults endured while they were going through chemotherapy. In fact, we were able to show that there was a significant reduction in approximately 10% of overall grade 3 or higher chemotherapy-related toxicity in those patients that received the geriatric assessment-driven interventions. So this really shows us that, for our older adults that are potentially more vulnerable, if we perform a geriatric assessment that helps us to capture the whole picture of the individual, such as their functional status, comorbidity, nutritional status, and then intervene on those vulnerabilities, we're able to actually allow them to tolerate treatment better and really prevent serious toxicity to treatment. This year was really unparalleled at ASCO because during the older adults with cancer oral session, there were actually 3 large randomized controlled trials that really showed similar findings. And they had slightly different approaches. Ours involved really, I would say, a very detailed approach in terms of a multidisciplinary team intervening. And then others showed just giving the geriatric assessment itself might influence oncologists' decision, whether it's dose reductions for those patients that are starting a new chemotherapy, whatnot. So I think what it tells our clinicians broadly is that no matter where you are in the world and no matter what kind of resources that you might have, just by doing a geriatric assessment in itself is probably going to be helpful. And then again, depending on how much resources you have, you can adapt in terms of how aggressively you want to intervene and how detailed you want to intervene. But at the end of the day, by just doing the assessment and doing some form of basic intervention is probably going to really help your older adult with cancer.